So I have a very special guest and friend here with us today, Dr. Jennie Luna. So Dr. Luna finished her medical education at the Universidad Iberoamericana at Santo Domingo in Dominican Republic. She did her internal medicine training at St. Joseph's University Medical Center in Paterson, New Jersey, and then later completed her endocrinology training at East Carolina University Brody School of Medicine in North Carolina. I had the pleasure of working with Dr. Luna professionally as an attending physician during her residency training and as a colleague in the practice of endocrinology. She is board certified in both internal medicine and endocrinology and is a diplomat of the American Board of Obesity. More importantly, she is the CEO and founder of Nido, a lifestyle brand dedicated to the education of the public through science-based information on health wellness. She had helped many clients achieve the healthy lifestyle necessary to prevent or improve chronic conditions, including obesity, metabolic syndrome, and diabetes. She also educates the public through her video modules on her YouTube channel, Nido Lifestyle. So I'm very excited to have Dr. Luna join us today to discuss with us strategies on maintaining health and preventing chronic conditions. So welcome to Optimistic Realist, MD.
Thank you for having me.
Yeah, this is exciting. I've been waiting to do this for years.
I know. I'm glad. I'm really happy to be here.
Yeah, so how long have we known each other now?
A long time. When we had the dream team in residency, I was just a baby doctor resident. That was in 2010, around there.
Wow,
so been a long
years.
time.
Gosh, I feel old now.
Me too. No longer a baby doctor.
Yeah, so since that time you've done your endocrinology, had the pleasure of working with you for 2 years and in private practice, which were it's got its ups and downs,
right.
With private practice. So why don't you just tell the viewers a little bit about yourself and why you chose the field that you chose?
Yeah. So in addition to being a doctor and also CEO of the company, I'm also a mom, which brings its challenges on its own. And I went into endocrinology because I wanted to specialize in a field in medicine where I felt I could do something, with managing patients with diabetes and kind of have an impact on their life. I was always very intrigued also by just the hormone pathway and the receptors and how the body works and, what manifests when patients don't have kind of that smooth flowing, let's say, of how the biochemical reactions take place. So multiple reasons, but I love endocrine. I think, obviously, we would say this, endocrinology, I think, is the best specialty in medicine.
Oh yeah, I love the field, and I think
never boring.
Yeah, and what drew me to endocrinology is the same thing. It's the hormone pathways,
Right.
the different the feedback mechanisms, the whole science of it. I think is just fascinating. And the other thing I really like about it, different from a lot of subspecialties, is that it encompasses almost the whole body.
Right.
Because we're taking care of all the different glands from, pituitary, adrenal glands, thyroid,
The fat.
yeah,
endocrine organ.
Adipose tissues, so adipose tissue is one of them. And then now I think there's also more endocrine involvement too with the gut metabolism.
Right. Right.
Okay, which is something we'll touch on later. This whole fascinating area now that's taking off with the whole gut flora.
Right. Right.
Yeah. So I know. Well, we worked briefly for 2 years, and I know it wasn't a easy choice for you, but you decided to leave mainstream medicine to really pursue your passion, which is really to help people with their lifestyle.
Right. Right.
So what was it about medicine as it was that sort of turned you off to the whole practice?
Yeah, that's a great question. And I think it's a question that many doctors ask themselves and they struggle with. Um, we all go into the field of medicine to help our patients. We want to, again, cause an impact in their life with our area of expertise. But when you're out there in the real world, after you're done training, you realize that that's not always necessarily the case.
Hmm.
So it was difficult to see patients with diabetes already at the end of the spectrum where they're having amputations, they're going blind, they're on hemodialysis, they're on 4 shots of insulin, but then their whole lifestyle is still the same. They've already had stroke, whatnot. So it was hard for me to unsee what I had already, like actually
Hmm.
noticed, that these things could have definitely been prevented. So, it gets to the point where you're like, what am I doing? Am I really
Hmm.
causing difference in my patients' lives? And 15 minutes is just not gonna cut it to
Right.
actually cause a change in these patients' lives. So I said, you know what, I'm gonna stop complaining. And it took a lot of courage. And like you said, it wasn't an easy decision to kind of go on my own and try to figure out ways where I could help and I could feel that I'm actually using my medical degree to impact patients' lives or people's lives.
Mm. Yeah, and yeah, and it's a tough decision
Yeah,
because you've already invested so much
yeah,
time, you've already invested so much money, into the training of
right,
medicine.
right.
And then on top of that is I I think on top of that is also uh, because I've thought about this all the time is what are my colleagues going to think about me?
Yes, yes.
It's
Yeah,
like
I heard so many things like, but you know, but you're a doctor, and how are you going to leave medicine? I'm like, I am a doctor, and I'm not leaving medicine. I'm just doing something different,
right,
And
right.
it's hard because we're also so trained to, work a certain way,
Hmm.
and breaking free from that feels wrong, but then at the same time, it just kind of felt right.
Yeah.
So
Yeah, and I think that has to do with medical training too, is that we're
right,
sort of trained with a very narrow view.
right,
We're trained sort of within a box, within a medical structure.
right,
So sometimes, especially when we're talking about prevention of
right.
chronic conditions, is that you really have to think out of the box.
Hmm.
Okay, because of what we're trained through medical school, residency, fellowship, is we're being trained to take care of disease conditions.
Yes.
We take care of diabetes problems when it
Mhm.
comes up. We take care of thyroid problems when it comes up, pituitary. I think all of us are very versed in terms of treatment, of
Right.
workup and treatment of these conditions, but the prevention part is very difficult.
Yes.
I think most patients go into doctor's offices thinking everybody, that your doctor should know a lot about nutrition.
Hmm.
Especially if you're in the field of endocrinology, is that you should be an expert in nutrition.
Right.
Well,
Right.
I yeah, but looking back at my own training,
Hmm.
we I've probably had what 3 lectures
Yeah. Yes, you are
of like
correct.
3 lectures on
Right.
nutrition,
Right.
and then they expect you to learn everything about nutrition within that 3 lectures.
Right, right.
You know,
Yeah.
and
Or
and
how to take care of a patient, let's say on TPN in the hospital. I'm like, okay, but how is that going to help my patients that I'm seeing in the office? And yeah, I mean, because of that, this was a whole, several years of thinking and preparing and saying, I felt the same way. I was like, lacking the I'm lacking the background of nutrition. At one point, I even considered maybe I should go back to do nutrition training or something.
Mm-hmm.
And that's where I did a few courses online and just reading, PubMed, and kind of, obviously as a physician, it's easier, especially as an endo, it's easier to understand exactly what's happening from a nutritional aspect, and then how does that relate to the gut flora, their hormone levels and everything else. So, from cooking classes, I even went to culinary school for a year, to becoming a health coach. And then, again, just trying to form these pieces to fill those gaps where we're actually effectively helping people.
Yeah, and it's a lot of these, I call it post-training training.
Yes. Yeah.
This is training that nobody's going to guide you. It's training you have to do on your own to learn about these things.
Right.
And in a way, this is the sort of the magic of the internet. Is if you're motivated enough to learn something, there is going to be something on the internet for you to learn, courses, videos, material. Of course, you have to sort through what's relevant and what's not relevant.
What is science-based?
I think for me, like you said, is the medical training at least helps you sort through, this material to see, which material is something that's, have a scientific basis to it.
Right.
Okay, and which of this material is a expert opinion or opinion of somebody who is writing about it.
Right.
And my specialty, as an endocrinologist, I concentrate a lot on thyroid. You know that. I mean, how many thyroid ultrasounds and procedures I do in a year.
We were a perfect match, because thyroid was you, and then metabolic, diabetes, obesity was my realm. So it was a great match.
Yeah, but even in thyroid, I tell a lot of my patients this, is when I was doing my internal medicine training, I was like, what does anybody specialize in thyroid? It's either your thyroid is high or low, you treat or you don't treat. There's just nothing interesting about it. Well, the problem is, once you become a thyroid specialist, then all of a sudden you realize there's really a lack of literature out there.
Right.
In a lot of things we do, even in thyroid. And diabetes, I think it's a much more involved disease process, because we're talking about multi-organ involvement. And even with the amount of literature that is out, we're really only understanding, probably a little bit more than the tip of the iceberg.
Yes.
When it comes to these things, and especially nutrition. Nutrition is sort of this mystery. It's like this mystery box that we don't really know, what's considered good, what's considered bad. Even a lot of research that's done on it is very limited. Let alone watching, documentary on nutrition is absolutely confusing.
Yeah. No, and everyone. And I find everyone has an opinion, right, on what you should eat, what you shouldn't be eating. But the way I find, that just to kind of view nutrition from a scientist perspective, it is very personalized. So it's kind of like every patient we see, even if you have two patients that have the same exact list of chronic diseases, the treatment is completely different. And nutrition is the same way. So, someone might do excellent on a vegan diet, while someone might do better as a vegetarian, or, but I feel like that's where the problem actually arises, where we try to put everyone into one nutritional box and say, this is the diet that you have to do. Yeah. So
Yeah,
that's the issue.
yeah, and how many times that we had diabetes patients come in and says, doc, can you just give me the diabetic diet?
Yeah, no. Yeah,
It's like
yeah.
I don't even know what a diabetic diet
I,
is.
so yeah, and then it's like carbs are bad, but not all carbs are bad, and it's just and it's difficult because it's confusing even for healthcare providers, and imagine for patients that are hearing, do this diet or the other diet, or avoid these types of foods, and it's just like, it gets to the point that it's so confusing that then they go back to their old habits, which is, you know what, I'm just gonna go have the cheeseburger and French fries because that it's less confusing, and it's what I've been doing. So yeah, I mean, working, I think, on an individual basis with people, but we know, right? That, I mean, I think everyone in the nutritional realm can come into agreement that eating real food, whole foods, eating more plant foods, definitely, the literature is there over and over and over again, on the benefits that it has on the body, from the microbiome to, longevity to, keeping a clear focus, to preventing chronic diseases as well. So that at least I feel in the base, it's like a common denominator. I feel when there are physicians that start to demonize even plant foods, it makes no sense.
Mm-hmm. Yeah, so let's talk about your main project. Let's talk about Nido. How did you come about starting Nido?
Yeah.
Because I know when I even yeah even I you started this what 4 or 5 years ago
Yes.
as
Yeah.
sort of a side project to your private
Mhm.
practice.
Right. And it was all, I finished fellowship in 2014, and then, fellowship, as you know, it's beautiful. I mean, you're with your mentors, you're learning, you're seeing all these cases in the hospital, and you're just um, so hungry to learn more about endocrine, and it's really all about the patient and learning. So, when I was in fellowship, I was like, oh, this is great. I mean, I am so happy that I did this because, internal medicine residency was another story. So, but then once I finished and you're out there in the real world where, it's corporate. I mean, you've got to chart, you've got to see a patient every 15 minutes, or maybe see 2 or 3 in 15 minutes. You've got to bring in those RVUs. You've got to, cash in money for this organization that now you've had, pretty much signed your life to. And in that, I was very almost close to depressed because I felt like I didn't have a purpose anymore. I'm like, this is not what I signed up for, so I wasn't going to quit because, like you said, you train to do this. And it's like, how do you not be a doctor when you've been training for over 10 years?
Right. Right.
So then I was like, okay, I need to figure something out that is going to make me feel that I am using my knowledge for the greater good. So that's where Nido came about. Nido actually means nest in Spanish. And I thought about the name when I was coming back from vacation from Costa Rica. And it showed me, too, the importance of vacation because you are out of the craziness of the day-to-day. I could have never thought of the concept, getting out of the office and whatnot. So just having that distraction actually allowed me to think about this. And I'm like, I'm just going to create a community, a nest of people that, want to learn how to live a healthier lifestyle, start to adapt changes in their behavior. So that's where all of this came about. I started to help family members, friends, how to kind of incorporate a healthier way of living. And then I started noticing that it wasn't only because I was a doctor that they were improving and losing a lot of weight, 30, 40, 90 pounds. But it was more because there was that sense of community. There was that sense of accountability and knowing that I genuinely cared for their outcome. So that then took kind of another shape of now going to social media and creating a virtual community. Then it expanded to a YouTube channel. And it's still metamorphosizing. I always get more ideas about it. It's my passion project, to the point then that, back in 2018, I told myself, you know what, I'm just going to focus on this and kind of take a year off. And that's where I kind of pursued that. So.
Yeah, and the whole sense of community is very important. I mean, we see this study after study. We look at lifestyle, at study after study showing positive benefits of lifestyle changes.
Right.
It all involves having a partner in crime.
Yes. Yeah.
Having somebody there to keep you accountable for what you're doing. And this is what really keeps you on track.
Exactly.
I mean, for example, if you're going to start a business, it's very important to have a business mentor to keep you on track. So this way you don't just run out of steam and you stop doing things, because, anything you start, lifestyle is extremely hard. And what I tell patients is, when I'm asking you to change your lifestyle, I'm actually telling you to take whatever you've learned the past 30, 40 years and throw that out the window, and then starting today, you start something new.
Yeah, but that's easier said than done. I call it the cassette player. For those listeners that have no idea what a cassette is, because you were probably born after 1995. So it's like the cassette. You remember when, I don't know if you used to do this when you were a kid, where you could actually record a song in top of another song, and kind of use the cassette like that. So it's like our brain, and we are creatures of habit. I mean, we wake up in the morning, we brush our teeth, we comb our hair, we drink coffee, we meditate, we do whatever. But, it's like we do the same thing over and over again, but there is a sense of comfort with that. Even if those habits are probably not aligned with what you want, are not aligned with what your goal is, but it's what you know, right? So when we try to tell our patients in 5 or 10 minutes, listen, I want you to start to eat more plant foods, exercise 30 minutes a day, 5 days a week, incorporate resistance training and cardio. And by the way, I'm sending your prescription to the pharmacy, and please take your meds. Bye. And then you have to go chart for the next, 10 minutes. It's not going to happen.
Right.
And many of our colleagues are like struggling with weight too. I'm like, how am I going to take advice from you when you got to definitely lose 25 pounds?
Right. And we see this with we see this with healthcare workers. I mean, healthcare workers, doesn't matter if they're doctor, nurse, medical assistant. I think as a whole, we probably have the poorest health.
Yeah.
Just because we take care of other people, but we don't put that same amount of effort into taking care of ourselves.
Right.
I mean, how many doctors do you see, after the age of 60 actually being disease free?
Yeah, no.
It's almost non-existent.
Yeah, I mean, they would have to. I mean, I feel like now that definitely is hopefully changing. But even though we are creatures of habit, like I mentioned with the cassette, we have that capability of re-recording, little by little, little habits here and there that are then aligned with where we want to see ourselves. So I know you have made a lot of changes in your lifestyle. Little by little, right? How did you do that?
I just I started back in last summer. So like everybody else, I felt like crap. I wake up in the morning, I'm tired, I'm achy all over. I don't know if you still remember, I used to have like those inflammatory, like lower extremity pains.
Yes.
It got so bad. It got so bad last summer. I was actually popping, high doses of prednisone, just to be able to get myself to work.
Right.
just to be able to get on my feet and get myself to work, and it was just getting worse and worse. And so last August, I just had this, I don't know, revelation, I guess,
Yeah.
one
Yes.
day.
Yes. Yeah.
And actually, it wasn't much of a revelation. This is like, and I still remember the day. I still remember the day. This was probably the lowest point of my life. Was I woke up in the middle of the night and I have this tremendous pain in both of my ankles.
Mm-hmm.
It's like they're both swollen, they're painful.
Yeah.
Um, and I left my I left my medicine downstairs.
Mm-hmm.
And so I got up in the middle of the night. This was like 2 or 3 in the morning because the pain was so unbearable. And
Yeah.
actually remembered I was crawling myself
Yeah.
through the bedroom, down the hallway, going down the steps of my butt, and like crawling my way to the kitchen so I can get to my prednisone and painkillers. And then it's at that point you're just like, what am I doing with my
Right.
life?
And you're strong too. I mean,
Yeah,
yeah.
yeah, and I especially because I spend what 80% of my day telling people how to live healthy, how to take care of themselves, and here I am, basically, working myself down to the bones to the point where I can't even concentrate on my nutrition and exercise. Yeah, so from that day on, I was just like, this is ridiculous. How can I be credible taking care of my patients if I don't start taking care of myself?
Right. Right.
And this is when I start changing my lifestyle. Changing the way I eat, changing my nutrition, uh, making sure that I really uh, take the time to find that 20-30 minutes every day,
Right.
to get some exercise in, just to get myself healthier.
Right. Right.
And it didn't, I mean, it's not a miracle. I mean, it didn't, the improvements didn't come overnight.
Mm-hmm.
But then I kept this going day after day, week after week. And I think it's with any type of habit change, once you get over that third week,
Mm-hmm.
things get easier. So
Yeah.
after I got through that initial 3 weeks of lifestyle changes, it just got better, and then things just continue to
It's a new
improve.
song on the recorder. It's a
Yeah.
new song. Yeah. It's much easier after that.
Yeah, so I mean, for me, and again, this is different for everybody because the lifestyle change, as you said, is very individualized.
Right.
For me, it's intermittent fasting did wonders for me.
Right.
Just being able to fast a little bit longer,
Mhm.
utilize that anti-inflammatory
Right.
effects of fasting, and that really changed things for me.
Right.
Yeah,
Right.
and we'll touch on that later on too when we talked about some of these lifestyle changes that people can
Mhm.
do. But for me, I mean, it really, the motivation came when I was really in the pits. When you feel like life can't get any lower than
Over.
this.
Right. Right.
you
Right.
know, you know, but the challenge is how how do you start motivating people to start taking care of themselves without having to get to this point
Right.
where they're feeling so terrible that now it's you have to make this life or death situation, decision.
Right. Yeah. So that's a great question, and maybe not the easiest answer, because again, every patient, every person, every individual is so different. But I find that one common or question or that we could actually ask ourselves is, why am I doing this? Like, why do I want to lose the weight?
Hmm.
Why do I want my blood sugars to improve? Or um, you know why do I want to feel like I'm my age and take care of my body. And whatever that answer is, it has to be an answer that resonates beyond superficial things, like, you know, a wedding that I have to go to in 2 weeks, or yeah, we all want to feel comfortable in our own skin, yes, but it has to be something deeper. And I find that when I've asked this usually is the first question I ask people, is why are you doing this? And when I hear answers like this, I want to be able to chase after my grandchildren without having pain in my knee. I want to be able to get on a roller coaster again, because I can't do that right now because I'm so overweight. I would like to travel and go sightseeing. So again, these are very specific, personalized answer that only that person can answer it, which then will increase their motivation, because it's something they could always think back to when they're feeling lazy, when they don't want to do something, when they don't want to give those 20 minutes, again, because that old cassette keeps playing in the background, and we're trying to build a new one. So, you know, I usually tell patients, just keep that reason in your mind. And when you don't want to do something, like you don't want to prepare your meal, or you don't want to give yourself those 20 minutes, just don't think about it and just get up and do it. You know, don't just tell yourself, this is why I'm doing it. I'm just going to do it. Because the more you do it, the more you're building that habit, even when you don't want to do it. So that in itself is a track of motivation. But, you know, when we're waiting for motivation to kind of kick in, it's like a shooting star, you know. It's like some days we wake up super pumped, but I don't wake up motivated every day, you know?
Right.
Not like we're like, yes, I'm going to just conquer the day every day. No, that's not, I don't think that's correct for everyone, at least.
Right.
Yeah. So it's just being clear with what you want to do. So, yeah.
Yeah. So going back to the motivation, it's it's really hard to get motivated to change.
Right.
You know, it takes a lot of motivation, and you know, it's unfortunately, I think a lot of times it takes something drastic,
right,
to actually give somebody that motivation to change.
right.
But I think, as you said, I think a lot of us get stuck with temporary goals. You
Yes.
know, losing 20 pounds for the wedding,
Right.
you know, looking good for the photo shoot, or
Right.
you know, so I think if you have a temporary goal like that, is you think, oh, I only have to do this up to a certain endpoint,
Mm-hmm.
and then once you hit that endpoint, then you're just like, oh, that's it. You know, I'm going to go back to the way, you know,
Right.
I'm just going to go back to the way it is.
Right.
The other thing I was thinking is, there's a lot of emotional barriers that come with lifestyle changes.
Right.
Okay, because a lot of things, and we see this, especially with food.
Mm-hmm.
Okay, there's a lot of emotional attachments that a lot of people have with food.
Right. Right. And
So it's
chemical reactions, yeah, that take place that, you know, that make us, you know, want to eat and do bad things with food.
right,
When we're
right.
stressed.
So
I mean, it happens. Yes.
yeah, so if you have something that makes you feel good,
Mm-hmm.
you know, let's say you're stressed, you're having a crappy day, you had a bad day at work, you know, and you come home and you know that you're gonna get this good feeling if you eat certain things. I mean, for me, it's Doritos. You know, if I eat Doritos, I feel great, at least for the moment. But it's a comfort food. You know,
Right.
it makes you feel good, and this is why it's a challenge sometimes, to take people out of their routine,
Right. Right.
because this is where they feel, where they're safe.
Right. Right.
Okay,
Exactly.
you know, when they do these routines, when they eat this type of food, is that it makes them feel like they're safe,
Mm-hmm.
and I think that gives them that sense of, comfort and security.
Right. Yeah, I find that really digging into the reason why we do the things that we do, is the best way to address it. You know, I mean, when we tell ourselves, I'm not going to have that chocolate cake, I'm not going to have those cookies, you know, or whatever it is that triggers that reward circuit in our brain, and then triggers these behaviors that follow, we need to understand why it all started. You know, there's always a reason. Okay, I had a stressful day at work. I'm fighting a lot with my spouse. When I was a kid, my dad said I was fat. You know, like, so that is not going to go away if we tell our patients, stop eating those cookies before you go to bed because your blood sugar is going up to 300. You know, it's kind of like putting a Band-Aid on a surgical wound and thinking that it's going to heal. So, you know, everyone has their triggers to trigger that reward circuit. Some people, they like to shop. Some people might grab that drink. So I feel like the more the person understands why they're doing the things that they do, the better they will get at actually cutting that behavior. So yeah, food is definitely something that has become a reward, and especially in our culture, because everything socially has to do with food. You know, we're happy, we eat. We're sad, we eat. We're bored, we eat. And then there's just food everywhere, and the quality of the food is not the same. You know, there's the food that is out there is food that causes fat production, and it's all a vicious cycle. So I feel like just having that understanding of why the person's doing what they're doing makes it much easier. What's the behavior? You know, what's triggering this? And then switching again, recording a new song. Then maybe instead of sitting to watch TV and start to eat, you know, because mindlessly, a lot of people tend to do that. You know, maybe read a book or have a conversation with your spouse, go for a walk, you know, while you're kind of forgetting, like you said, what you've been doing for the past 30 years. So try to re-record something new so it's more effective.
Right. And it's yeah, and well, I was thinking the other thing that triggers a lot of eating is boredom.
Right.
If you have nothing better to do, why not eat something?
Like now everyone's in quarantine because of COVID-19. So, you know, I saw this meme today actually that the meme said, it's now recommended to wear a face mask at home so you don't continue to eat. Oh my gosh. Yeah. So there's that.
You have to put like, you know, like those chastity belts in the old days, you know, just put it across the face and lock it up.
Or the cone that I put my poor dog Leo when he has you know, something he cannot like lick or anything. You know, the cone collar thing they put to the dogs.
Right.
Yeah. So I tell people I work now. I did integrate back into medicine just because I missed it, and I work with special needs patients for a few days in the week, and the other day of the week I work with patients that are struggling with weight. And I tell the patients while I'm doing the telehealth, I say, you know, the first 2 weeks of quarantine, you were allowed to eat all the chips and all the things you wanted because it's kind of like all of a sudden we got a vacation, but now it's time to make this the new norm. You know, wake up and tell yourself, I'm going to have my coffee, my tea, I'm going to meditate or you know, take a moment to pause, and I'll go for a walk or do my 20-minute exercise routine. Then I'll get dressed, sit in my computer, do my work, you know, for lunch, prepare something. So your home has now become not only a place for you to relax, but a place of business. Yeah, instead of just, you know, watching Netflix or grabbing whatever snacks there is without any plan.
Oh, even better, eating snacks with Netflix.
Yes. Exactly.
So what would be the one, you know, if you have to give somebody one advice about how to start heading in the right path towards a healthier lifestyle, what would say would be your advice?
Yeah, I would say do what makes you happy. Because for my own personal life and challenges, I find that my whole life I felt that, you need to exercise 5 days a week, and you have to eat your vegetables and make sure you're getting the good nutrition. So very rigid, very structured. But then emotionally, I wasn't well. So what did that develop? Gastro issues, where I felt like this burning sensation, GERD, feeling down, and then sometimes not wanting to exercise and maybe going for that comfort food more than I would. So I find that when we start to treat patients in a way, or we start to treat ourselves more as a human and searching why am I feeling like this? Why am I going for that cookie? Why don't I want to go for a run? I have all this amazing, machinery here of a body that does all these things for me. Why am I neglecting it? And I find that when we start from within, everything else just kind of falls into place. So we don't change because of what we know. We change because of what we feel. So when I started to realize that I wanted to go to the gym more because I wanted to take care of my body, then I was like, I don't like going to the gym anymore. I started Pilates, and that has gone great. Not being so structured and telling myself, I'm feeding my body in a way that I want it to nourish. I want to nourish it, not because, I want to fit in whatever size. So that has kept me consistent through the years, more so than many people that I see, colleagues as well, where they're yo-yoing. They're always trying that new diet, but they never really fix the problem from the source, and is us, right? So that would be my one advice to start a healthy lifestyle.
Yeah, and that's a great advice. I mean, even for myself, I think like you said, I made the determination that feeling healthy will make me happy.
Right.
It will make me happy, which then really then would permeate into every part of your life.
Exactly.
Your interaction with your family is going to be more positive. Okay, when your kids come to ask you to play, you don't just shoo them away because you're so tired.
Right.
You're tired. You don't have the energy to do it, and even worse is in my case, when I was having those joint pain, is I couldn't physically do it.
Yeah.
If my daughter wants to go outside play basketball, well, I couldn't physically do it because because of the joint pains I was having.
Right.
So like you said, it's deciding what your priorities are, deciding what is most important in your life that's going to give you that positive reinforcement to keep going.
Right.
And yeah, it's not easy to get here.
It is not easy, no. And that's what people have to understand. We have to take responsibility for what we do in our life, and I'm very loving and kind with all my patients, but they need to hear the truth as well, which is we are responsible for what happens to us, and it's your choice, right? What you have to take the time to think, okay, what is going to make me happy? Maybe it's a different career choice. Maybe it's finally ending the relationship that I was trying to make work but didn't. Whatever it is, but just thinking that you're going to get that one pill that's going to fix everything, that's going to, if you lose those 30 pounds, all of a sudden you're going to be happier and you're going to feel better. But in reality, that's not the case. It's kind of like, when we're pursuing a career and we say, when I get to the top, that's when I'm going to be happy. But then you get there and you're completely empty. So, it is easier said than done, but we have to take the time. I mean, if we're going to do it, might as well do it right. That way we're not yo-yoing from one diet to the other, or one crazy exercise routine to the other.
Yeah. By the way, it's a fallacy. There's no such thing as the top.
Right. Yeah, exactly. And then there's some people are always struggling for that power too.
Because once you get there, you're struggling to get up to the next level.
To the next level, right.
Yeah, so then you get caught into this revolving thing, and basically then your whole life just becomes a struggle,
Right.
because you don't quite enjoy what's in the present now. You're always
You're
looking
looking
further and
ahead.
further
You're
ahead.
looking ahead.
Right.
I think this whole pandemic has definitely taught us that, you know, what life was prior to COVID-19 to what it is now is really, it's humbling, to
Mhm.
show us really what matters, how vulnerable we really are as humans, and really puts priorities a little bit more aligned where we should have them.
Right,
So,
right. Yeah, and then one thing a lot of, from talking to people is that this period of time really forces them to reflect on
right,
themselves.
right.
So you don't have as many distractions
Yes.
to keep yourself occupied.
Mm-hmm.
You're not going to work, you're not driving, you're not commuting that 2 hours, every day. You're not you can't go out and just hang out with your friends or go out and buy something, because now you're forced to stay in.
Right, right.
And that's a hard thing. I think a lot, it's really hard to be able to reflect on yourself
Mm-hmm.
and then be critical, being critical of yourself and being able to accept that criticism,
Right.
of what you think you're doing right, and what you're doing wrong. And for that's part of the reason why I started this podcast,
Mm-hmm.
because I had time to reflect on everything, and I was thinking, like, well, what is important for me?
Right,
Well,
right.
what is important for me, and the same thing for you, and I have to thank you for giving me this motivation to do this.
Yeah.
It's really, for me, it's really about educating
Right,
somebody,
right.
and when you think back to my practice style, it's really helping the patient understand
Mm-hmm.
and realize, what their condition is and what brought on their condition and how they got there.
Mm-hmm.
Because it's always been my belief that the more you learn about something, the more you understand something, is that the more control you can take over it.
Yeah, no, absolutely. Yeah, education sets us free. That's for sure. Yeah.
Yeah, and I think this is my goal. My goal is to be able to educate, you
Mm-hmm.
know, for anybody that wants to listen. My goal is to educate you
Right.
on your health, on your endocrine system,
Mm-hmm.
on different things that you can do,
Right.
just to be healthier, be happier.
Right. Right.
And it only took me, what, 44 years to get here.
It's better late than never. That's for sure.
So you see, so you can either call this a revelation or a midlife crisis.
Really?
Yeah. So for anybody who hasn't checked out Dr. Luna's YouTube videos, you have all these great modules on there to start getting everybody on track.
Right. Right.
So you have parts 1 through 8, and then I guess once they make it through 8, uh, what they get a black belt.
No, well, they already, if they follow each and every module, very short videos, and they're very fun because they have animations. I worked with an amazing animator, Caitlin Henderson, who really brought to life all of these hormones and, our protagonist, his name is Odin, and a storyline that many of us could relate to,
Mhm.
where we're kind of busy with work and we just self-neglect, and that results into weight gain and all of these other issues. And through the modules, we're learning with Odin on how to make these changes, not only on food
Mhm.
and nutrition, but also with stress management, sleep. So, at the end, we kind of see how Odin progresses. He actually loses weight, and he's on the right path. And our goal was that every person that watches the videos and actually follows this is also going through a journey on their own as well. And at the end is kind of they're on a better track, more aligned with what their goal is.
Right.
Yes.
Yeah. So one thing I just want to, you know, I did make it through modules 1 through 8. I'm
Okay.
okay. I'm gonna be expecting that black belt in the mail one of these days. Um,
Yes.
but but there's one thing you mentioned with exercise I thought was extremely interesting. This whole idea of exercising and producing this hormone called irisin,
Right.
which then helps stimulate the conversion of
Right.
back to brown fat. So
Mm-hmm.
so for people who don't know, is that you know, there's two different types of fat in the body. There's brown fat and there's white fat. Brown fat is the more metabolically active, or we call more thermogenic fat, and that's the one that actually burns calories.
Right.
Okay, as opposed to white fat is mainly for storage. Okay,
Exactly.
so you know, so as you age, is that you end up losing more brown fat and you start gaining more white fat. Okay, this is part of the reason why it's, you know, your metabolism. I guess one of the many things that causes your metabolism to change as you age, and then and also, you know, one of the factors that make it so hard to lose weight once you get older.
Right. Right. Exactly.
Yeah, so
And
so I don't know if you could just tell us a little bit about this hormone, and 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 do you think this is going to be the next miracle pill that we'll be giving
no,
people?
I don't believe in the next miracle pill because it doesn't exist. There's not one pill that can possibly take care of every angle of a person's life or lifestyle. So no, it's, you know, it's amazing, and this is why I'm pretty sure you also went into endocrinology to see, and that we don't even know, you know, a great majority of what the human body actually does. You know, it's always so humbling to know that we know nothing really. You know, we just know little glimpse of this movie, which is our human body. But yeah, there's this hormone that actually is excreted when we are exercising, and it's excreted from the muscle cell, and it goes into the fat cell. And now that you are exercising, maybe mixing some resistance training with some cardio or whatnot, in addition that now you're losing the white fat, which is the storage fat, now we're converting that into brown fat. And brown fat is, athletes have a lot of brown fat, obviously, because they're always exercising. Babies have a lot of brown fat as well, which keeps them nice and warm. But like you mentioned, is a metabolically active fat, which helps you burn more calories, which helps you, again, more aligned with what your goal is. So it's amazing how these little things are taking place in the human body where we're not actually seeing it. But knowing that it's happening, it actually serves as a motivator, because we're like, well, you know, even though I might not be seeing the changes in the scale, but I understand that there are changes already taking place in my body.
Mm-hmm.
So yeah.
Now, the other thing too is in another one of your modules, you mentioned this whole idea of it's called NEAT, NEAT, or non-exercise activity thermogenesis.
Right. Right.
And I thought this was a very important concept. If you want just tell the viewers what it is and why it's important.
Right. Yeah, so non-exercise activity thermogenesis, or NEAT, is basically all the other activity that we do that's not exercise. So that is when you're walking to your car, or you're standing instead of sitting. You're doing your grocery shopping. So it's all those extra steps, moving your hands. I'm Spanish, so I'm always using my hands.
Mm-hmm.
So it's all those extra activities that we do throughout the day that really sum up to calorie burn. Okay. There are people that spend the whole day sitting and then they go to the gym for 30 minutes. That's not as effective as that person that's, purposely, intentionally moving more. They park their car further. They take the staircase instead of the elevator. They stand a few times instead of sitting while they're in their computer. So these people are more active throughout the day and they're burning calories throughout the day versus the other person that is just sitting, eating and storing and then just burning a few calories at the end of the day. It's amazing the amount of calories you could, there's thousands of calories that can be lost just by actually purposely moving throughout the day. So as I usually tell, patients, don't, purposely try to move throughout the day. Don't just always think, how can I move more today? Maybe having a step counter and aiming for those 10,000 steps or a little bit more. And so then it's like that data actually helps people realize how many hours they're actually spending sitting and just, maybe having like 500 steps in the day. And this, I realize it more in patients that are retired. And I think you could agree on this. It's that you have someone that has been working their whole life, then they retire, and it's like all of a sudden everything starts to pile on, the weight, the diabetes and everything else, and because they're no longer active, they're no longer moving. Mm-hmm. It's even though they may have had a desk job, but they took a few steps for them to get into their car, get dressed, get to the office, versus now they're only home and eating. So yeah, NEAT is a great way to burn calories throughout the day, to maintain a healthy cardiac function, to maintain a healthy weight as well.
Mm-hmm. Mm-hmm. Yeah, and this is a great concept because I always tell people is you don't need to spend an hour exercising every day.
Right.
Okay, you just have to find some way to increase that activity. Especially we know that with in the studies they've shown just by sitting for 15 minutes,
right,
your insulin resistance starts going up.
Right.
So if your job at work is mostly sitting, mm-hmm. like most of our jobs are nowadays, unfortunately, right. is set an alert or something, so that you get up and move around every 20 minutes or so.
Right. Right.
Okay, as a way to sort of stimulate that that increase in metabolism and start moving and burning more calories.
Yeah.
And then this is part of the reason why I almost never sit at work.
Mm-hmm.
Because we have those little carts with
right.
the laptops. Yeah, and that just allows me to stand and expend more energy throughout the day.
Exactly.
Yeah, so I think I think it's great that there's actually a term for this.
Right.
Because I think if you have a something that's abbreviated, especially when it's this NEAT.
NEAT, yeah.
Is that I think it's easier to sort of ingrain that into somebody's in somebody's mind when you're talking to them about this.
Right.
Just a few more questions. I'll let you go. I know you're busy. Well, if you've seen any of our other videos, one of our co-hosts, Nick, okay, he's also very into healthy living, and one of his big things is meditation.
Right.
Okay, and that's one of the things that you mentioned in the modules.
Mm-hmm.
I've never really taken meditation seriously until recently. It's again, it's like meditations are for these the new age people who I guess have nothing, better to do with their 20 minutes. But 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 then now is you start seeing how important it is.
Right.
Okay. So what do you do? What do you do for your own meditation?
Yeah, so that was also something of like self-discovery kind of thing that I felt obviously very stressed. Everything happened right after you get into private practice. You're like, I need to like figure something out to like just calm down and be a little bit more focused. So I actually went for the transcendental meditation course, and I loved it. I mean, I was skeptical at first. So, as doctors, we're always skeptical, and we ask, where is the evidence to this meditation? And they did present it. I was impressed. I was like, okay. So, but then when you experience it, you realize the benefit. And now doing it for over 6 years consistently, every day, at least for 20 minutes, you really notice how much you change. And it is, we are run by our thoughts. Your thoughts telling you, you need to do better in this, or you have this errand to take. And, all of a sudden it's just your mind is kind of calling the shots on everything, these random thoughts. But then when you start to meditate, you actually control, more now like a spectator. So when you are faced with stress, when you're faced with things that in another situation would have maybe caused anxiety, now because you've been focusing on your breath and you've been kind of moving your mind back into a specific focus, it's much easier now when you're out there in the craziness of life to relax and to realize that it's okay. You don't get that surge of thoughts and just kind of lost in a spiral. In addition to all of the health benefits from dropping cortisol, decreasing body inflammation, increasing gray matter in the brain. So after I started to actually experience the benefits of meditation, where I was more calm and maybe less reactive to things, I was like, well, what is the literature? And this is where I started kind of just reading more about it. What's some of the studies that have been conducted, and that's why I feel like that was such a key point to add into the modules. So people can know that it's not just something that New Age people do, that it actually has a huge benefit. I mean, this has been a practice that's been going on for, from the beginning of time. Right. But then you have to experience it to know. But it is a game changer for me. It's helped me wonders.
Yeah, and it's really just taking that moment to sort of refocus your mind.
Right.
Especially in this, with modern day society, we're always trying to multitask on everything. And, there's so much stress involved. You're always thinking about this and that. And for me, I find the benefit of it is just taking that few minutes to really just calm your mind.
Mm-hmm.
Calm your mind down, decrease that stress, refocus your mind, and this also helps you focus in on what's most important, of the priority of the 20 things you have to do. Mm-hmm. Be able to calm your mind down and to find what is the most important thing. Mm-hmm. Well, in a sense, it helps reduce stress because now you have more of a sense of control, and right, instead of this constant feeling of being this whole constant feeling of almost being helpless in a way. Mm-hmm. Because you have 10,000 things you have to do and there's no way you can get to all of it. But if you know what's important, if you can even just knock 5 things off of your list of 10,000, well, it makes you feel good.
Right. Exactly. Yeah. And it just allows you to just relax You know, I mean, I feel you're less driven by your emotions as well. The mind is just a little bit more serene in that case. Yeah.
Yeah. Well, you know what really helps me meditate? Washing dishes.
Yeah. Yeah, to really be present. I mean, yeah, a lot of people feel that they have to, like, you know, again, when we try to be too stringent and too structured, then we don't want to do it. So, you know, I tell people you don't have to, you know, sit down and, you know, get that meditation pose. You know, you could easily, like you said, when you're cleaning the dishes, just be fully present. Or, you know, sometimes when I'm walking my dog, I'll open my ears and what am I hearing? You know, I'm hearing the birds, I'm hearing the wind, I'm hearing the leaves, you know, so it's that in itself is a meditation, and you're controlling your thoughts because you're now focused on something specific versus just letting your mind wander wherever it wants to.
Mm-hmm. Yeah. And the last question, or the last topic, which I think is gaining more and more medical ground, and you know, of course, this can't be a whole discussion in of itself, but this whole concept of the gut flora.
Right.
You know, these trillions of bacteria that lives in your gut that we used to think are just freeloaders. They're
Right.
they're just there to suck off of your nutrients.
Right.
But
Right.
but now we're learning more and more that it's actually these gut floras are the ones who are running the show.
Right. Yeah. So it's that is, like you said, it is a very fascinating topic, and which I love because it's very new and it keeps evolving. But we have realized that, like you mentioned, the gut flora actually is running the show. From, you know, actually causing inflammation in the body and releasing inflammation, or releasing anti-inflammatory properties into the body, from triggering depression or making it worse. So it's little by little, all of these things are kind of you know, being discovered, that what is populating within that microbiome, what's there, is actually the picture of your health. And then again, from the root, so what actually is creating this microbiome? It's the food that we eat and the way that we live our life as well. So again, it goes back, everything is connected. You know, the food that, if you're eating, you know, the Western diet, which is high in animal, you know, protein and a lot of processed foods, a lot of fat, and, you know, bad fat in the diet. Now you're building a microbiome that's inflammatory, a microbiome that is going to continue to cause weight gain, that's going to continue to possibly make you feel more depressed, increase your risk of cardiovascular disease, diabetes, autoimmune disease, cancer, versus that person that even just changing their diet one day starts to change the microbiome. You know, now we're eating more foods that are high in fiber, more plant foods. That does wonders because we have, you know, towards in the colon, there are bacteria that live there that actually create anti-inflammatory properties that go into the body and kind of tame the immune system. They train the immune system on how to deal with viruses and bacteria and foreign things that come into our body, you know, decreasing the risk of chronic diseases, autoimmune diseases, that it is passed on in our genetic code, but depending on how our environment is, how we live our life, it really dictates, you know, what is going to present. A lot of people don't know that only 5% of the diseases that we see today are truly genetic. You know, only because your father had diabetes doesn't mean that you're going to get diabetes, you know, type 2 diabetes. So it's a world of its own. And I feel that it really, again, stresses nutrition and, you know, how feeding this body. You know what I mean? It only makes sense, right? It's kind of common sense. What you're putting in,
Right.
it's like it's like
Right.
a car. If you have a really nice fancy car, you're going to put like the cheapest fuel? No, you're not. So it's the
Right.
same thing with the body.
Yeah. And it's one term that's coming up a lot is a term of epigenetics.
Right.
Epigenetics meaning that your disease manifestations isn't all because of your genes. It's
Right.
also because of the environment. And
Turning.
and
Mm-hmm.
yeah, and I remember when I was doing my training at in the Bronx, and is 1 out of 8 people in the Bronx have diabetes. So there, when you tell somebody that they have diabetes, they don't even blink because they're
Mm-hmm.
expecting it. They're like,
Right.
well, everybody in my family has diabetes. I was just wondering how long it's going to take for me to develop diabetes.
Mm-hmm.
And
Exactly. Yeah. Like
yeah,
they
and
feel like it's like a given, right?
right. But I think what we're trying to educate them is just because you have the genes, it
Mm-hmm.
doesn't mean it doesn't. You still need the right environmental cues to express that gene.
Right. Right.
Okay, so just because you have the blueprint doesn't mean that you're gonna your body's going to act on that blueprint. You have to do something to sort of enact that blueprint.
Right. Right.
Yeah, and yeah, I just have this funny thought is that whenever I think of gut flora, I don't know if you watched the movie Men in Black.
Yes.
Okay, do you know that one scene where the patient where the person's head opens up and it's this little alien sitting in there
Yeah. Yeah.
controlling the body? Yeah,
Yeah,
that
that's exactly what it's like. We have, we actually have more gut bacteria
right.
than we do human cells.
Yeah, so
Yeah.
that's what I think about when I think of these gut flora. It's like these
Right.
little
Little guys.
creatures, little guys in our colon that's like pulling the levers and like
Right.
moving our systems.
Like, come on, champ, you can do it. Eat your vegetables. Yeah.
Well, as always, it's been a pleasure.
Oh,
I think it's always it's always fascinating talking to you about nutrition, healthy lifestyle. Really just getting uh, to our goal in
right.
endocrinology and other medicine is really the best treatment for diabetes, for example, is not to develop diabetes.
Exactly. Yeah.
Okay, so it's always fascinating, talking to you, discussing these issues. Um, Even before the show, we spoke about there's so much to talk about. We can't fit it all
Yes.
into one show,
Right.
into one episode. So, I'm hoping if we can get you back sometimes down the line,
Yeah.
talk about
Okay.
some more topics, elaborating on some of the topics that we've touched on,
Yes. Yeah.
today.
That would be my pleasure. Yeah.
Yeah, and as as to really getting that information out there, start educating people so they can
Right.
start making the right choices for themselves.
Exactly, exactly. And that they have the power to do that. I feel that, when patients become their number one advocate for their health, and understanding that it's really not the doctor. We're just here to coach you, guide you, make sure you're okay, and get you on the right path. At least that's what we should all be doing.
Right.
But at the end of the day, they have the full power, to do the changes, that they want. So they have that life that they want to continue to have. So.
Right. All right. Thank you very much. And I understand you're moving to California.
Yes, I
Yeah.
am. I am a native New Yorker from birth to now. And moving to California actually has been a plan for quite some time. I mean, I think you remember when I went to visit, I was like, that's it, I have to move there. Finally, then, 3 years later, it's happening.
Well, it's because California are full of these new age meditators.
Hey, I have to say, I meditated in the beach, and I think I said, I left part of my soul there. I was like, oh my God, this is amazing.
Yeah. Yeah, but I wish you the best of luck. I wish you the best of luck on your new ventures down the line. Um, that's it. I'm hoping we could have more discussions like this.
Yes, yes,
Yeah.
definitely.
And for anybody out there, if you haven't checked it out, check out Dr. Luna's 8-step module. Okay, I can even try to have her send you a black belt if you finish all 8 of them.
Black belt, yeah.
Yeah. All right. But good luck with everything and stay safe.
Thank you.
All right. Take care.
You too.
Bye.
Bye.